Good morning, good afternoon, good evening. Depends on when you're watching my video. Before I continue, I will please you should subscribe. The more you subscribe, the more you receive my video and the more you have the thought of going towards it. So you still share the video to your colleagues if you have the zeal to continue in the field of medicine, psychology, nursing, and sociology, even guidance and counseling, whether in the clinical practice or in the educational coverage. Today we are going to discuss on a topic which is very, very important and which I have turned to the order of the day. So this topic we are going to discuss is titled Psychiatric Emergencies. Human behavior is diverse and to an extent influenced by culture, nature, and through the process of civilization. Our environment and as well our gene play major role in our behavior and other attitude we portray or character as people usually call it. A behavior is conformed before it will be tagged a normal behavior. So there is a standard of a behavioral normality before it can say that this behavior is above normal conformance or below normal conformance. That means there must be a state of equilibrium in a particular behavior, which must be culturally accepted by the society upon which the individual belongs. So a behavior is considered normal if it is conformed to the individual cultural expectation or globally acceptable definition of what level of abnormality or what level abnormal when it is exhibited in excess. Or you can say that a particular behavior is exhibited in a behavior that is acceptable in a particular society, and that particular society behavioral level of normality conform the individual behavior. And in this course, if this particular behavior is in excess or below, let me say, deficit to the cultural expectation in carrying out this behavior globally, we now say that the individual behavior is posing the risk of going towards emergency. However, a behavior fall within the purview of emergency if it constitutes risk to individual and others, even to properties and other inhabitants of the ecosystem. So you cannot get up and keep fowl that doesn't belong to you, or you go and plug mango that does not belong to you in a sane society. So if your culture and your society did not permit such behavior, you don't dare try that behavior. You cannot just get a knife and start killing people in a society where there is no war, there is no crisis. That means you are posing risk of harm to the people around. So this particular behavior will require urgent correction or intervention. That is why it is called emergency. So let's go straight to what psychiatric emergency is all about. So psychiatric emergency is a crisis situation in which general individual function has degenerated rapidly to the extent that he or she rendered incompetent, no longer able to assume personal responsibility, and unable to exercise control over his feelings and action. So the individual also have challenges in carrying out activities of daily living. So if there is deficit in this behavior that the individual is supposed to be active or carry out unaided, we now term that particular behavior as emergency. And if it is in a psychiatric purview or environment, we will not target psychiatric emergency. However, psychiatric emergency can as well be a normal, it can be in a biological aspect, that is in a medical aspect or physical aspect, as well as in psychological aspects. So if you have a physical condition like dementia, like um, diabetes, and your leg was amputated, definitely we can at that point say that you have a crisis or you have an emergency which need an urgent attention. So before a situation should be tagged an emergency, that situation must require an urgent intervention before it will degenerate to the level upon which it cannot be attended to, or before it gets to level of fatality. So that is why we now say that for you to tag any situation as an emergency, it must fall within this particular purview. So this equilibrium of a behavior within a behavioral continuum, where I have said that behavior have a continuum of normal, abnormal, and subnormal. So if there is disproportionate or change or shift in this equilibrium level of global behavioral expectation, you can now tag that particular behavior as an emergency. So even the behavior in terms of psychiatry that require urgent control before it will cause risk to self and others, we also require an urgent expatriate or professional to curb that particular behavior in a psychiatric environment. It is a sudden psychiatric or emotional behavior that poses a threat to the cooperation of well-being of the patient and others within the environment, because we have a therapeutic community that is in the hospital environment. The cooperation of that particular patient with other patients, which is not harmonious, that individual need to be removed from that particular environment to a seclusion room so that the behavior can be corrected without sensitizing others or without stimulating others. So in a nutshell, so whatever situation that poses threats to the corporate well-being of even a patient, now you're talking about corporate well-being of you as an individual being a patient and others, which will require immediate restoration or attention. So without that immediate attention and restoration, an emergency have never been defined, because there must be an intervention. If not, it will degenerate to a fatal state, either death. And for this course, we want us to give you this sense of being that in a psychiatric environment, for you to curb this particular emergency, you must have some skills. And these skills is what I call crisis intervention strategies in the management of psychiatric emergencies. In a research I conducted, I was able to do so many strategies that is used or that can be used, which some hospitals like Psychiatric Hospital New Port Harcourt have started adopting most of those strategies. Even Federal Psychiatric Hospital Calabar are also adopting most of my research strategies. I believe some psychological home and some rehabilitation centers that I usually visit for special, consultation jobs usually, look into those strategies and inculcate them into their own institutional policies. So we are going to give more idea or demystify on different types of crisis intervention, and later we'll talk about those strategies in the next video. Crisis intervention are generally classified as psychiatric emergency. So, crisis intervention are classified according to a particular psychiatric emergency. But now we are talking about classification of psychiatric emergencies, which the intervention strategy will be discussed later. Sorry for that mistake. So there are several behaviors classified as psychiatric emergencies. Some of these behaviors include aggression / violence behavior, suicide, that is number 2, puerperal psychosis, stupor, and catatonic syndrome. We still have conditions like drug abuse, or you can say other drug abuse and substance related violence. So we have some situations that can erupt from the use of illicit substances. We still have rape as a crisis that needs intervention or as a psychiatric emergency. We have what we call extrapyramidal side effect. This EPSE is an adverse effect, adverse reaction of antipsychotic, which we usually take serious. For instance, we have things like dystonia and this ectasia. Sometimes you also manifest in a fatal way that the individual will be rendered useless, which is called neuroleptic malignant syndrome. So most of these psychiatric emergencies are as many as classified, and others include puerperal psychosis, even eating disorders, sleeping disorders, for instance, insomnia. We have body dysfunctional states, like body deformity. We have mania, schizophrenia, depression. We still have alcoholism. We have other conditions which are not tagged like a psychiatric condition, but they are an emergency if not caught easily. Like for instance, hypomania state of personality. They easily go into a manic phase of life. Even some characters like carrying out let me call it having a carnal knowledge of a little girl. Some people call it hemophilia. So these are things that we also see as an emergency, but the major of them all, which we usually see in a psychiatric setting, is aggression and violence behavior, with that of suicide. Puerperal psychosis is just like a condition, obsessive depression, and schizophrenia, basically with that of the one that is becoming the order of the day, drug abuse, illicit use of drugs. So these are major ones, but other ones are still salient, which are still brewing gradually. Like they are not yet, they have not come to the light because it have not been taken cognizance of. Let me just try to tell you, based on my research, I was able to find out that in this year 2024 upward to 2030, will have a high risk of suicide or high suicidal conditions, whether parasuicide, attempt suicide, and the suicide proper. So if I envelope most of the research factors that I considered as the reason why suicide will be the order of this particular period, you will not, you know, you, you will not understand the reason until I tell you. For instance, look at how the look at the political hemisphere or the economic management of the world, from United States to Africa and other continents so far. See that the political elites group are managing the economy to the extent that they are trying to make the whole world to be having what we call the upper class and the lower class, rather than having a middle class set of people. So that is to tell you that if in the course of trying to meet up, some persons may be carrying out some suicidal oriented behaviors, and hence, like parasuicide, carrying out a particular behavior that when you pursue that behavior, it can take your death, and it can take your life and lead you to death, which is parasuicide. So, in a nutshell, I would like to tell us to, first of all, talk to yourself. What kind of behavior are you exhibiting? And is this behavior an emergency, or will you pose to a psychiatric emergency? So that is all about the video. As you subscribe, you'll get some of the videos, and more of the videos will be dropping in your phone. Thank you, or your laptop or your system, depends on what you're using to watch me. So I want to thank you as you subscribe.